Have you ever wondered what guides a nurse's every move? Behind all their compassionate actions, there's actually a super detailed plan, a kind of roadmap that's all about ensuring patient safety and steering the journey toward getting better. Well, today we're digging into that exact roadmap, the nursing care plan.
All right, so here's what we're going to do. First, we'll take a look at how patient care has changed over the years. Then, we'll nail down what a modern care plan really is and break down all its moving parts. We'll walk through the five-step process nurses used to build them, see how they actually work in the real world, and then we'll wrap it all up with why this stuff matters so much. To really get why care plans are so absolutely critical today, we kind of have to take a quick peek back in time, because it really wasn't that long ago that the whole approach to nursing was just completely different. Just look at the massive shift here. Back in the 70s, care was activity-based. It was all about tasks, like a checklist. You can just picture a nurse going down a list, take vitals, give meds, change dressings. Done. Communication was super informal, maybe just a verbal handoff or a simple work list. The focus was totally on what the nurse did, not on the unique person in the bed. Fast forward to today, and it's a whole new ballgame. It's a patient-centered approach, where every single plan is tailor-made based on a deep dive assessment of that specific person. So how did nursing make that lead from simple task lists to truly holistic care? Well, the answer is the Formal Nursing Care Plan, or NCP for short. It's the structured solution that brought order and coordination to the chaos.
Okay, let's really unpack this definition. An NCP isn't just a piece of paper. It's a formal process. It's about identifying what the patient needs right this second. But just as important, it's about looking ahead to what problems might pop up. And that's what makes it such a powerful communication tool. It gets the entire team, from doctors to therapists to the patient themselves, all on the same page, all working toward the same goals.
And here you can see just how much heavy lifting this one tool does. It provides the actual direction for that individualized care. It makes sure nothing gets lost when shifts change. It coordinates the whole healthcare team. It creates a critical legal document. It even helps with things like reimbursement. But most importantly, it clearly defines and tracks the patient's goals. All right, so we get why care plans are so important, but what are they actually made of? Let's pop the hood and take a look at the essential components that make up a really solid plan. Every single care plan is built from these basic blocks. It always starts with a really comprehensive assessment. We're talking the whole person, physical, emotional, social. From all that data comes a nursing diagnosis. Now, this isn't a medical diagnosis like diabetes. It's about the patient's response to a health problem, like risk for unstable blood glucose. Then you set the goals. Based on those goals, you lay out the nursing interventions, the specific actions a nurse is going to take, each with a solid, evidence-based reason behind it. And finally, you evaluate their progress to see if the plan is actually working. And this right here highlights a huge evolution in how we think about those goals. We're moving away from just purely clinical goals to functional goals that actually mean something to the patient. So a clinical goal might be increase range of motion. Okay, great, but what does that mean for my life? The functional goal connects the dots. Demonstrate enough shoulder flexion to comb their own hair. Now that's a goal. This shift makes sure the care plan is really about restoring a person's quality of life. Okay, so you've got all these components. How do nurses actually put them all together in a logical, systematic way? Well, they use a really simple, super memorable 5-step process. And it has a great acronym, ADPIE. You can probably see how this perfectly mirrors the components we just talked about. First, you assess the patient, grabbing all that data. Then, you analyze it to form a nursing diagnosis. Next up is the plan, where you set those patient-centered goals. After that, you implement the plan. You actually do the things you said you were going to do. And finally, you evaluate the outcomes. Did it work? Did we meet our goals? If not, the whole process circles right back to the beginning and you tweak the plan. It's a constant, living cycle. Now, during that plan stage, it's not enough to just set any goal. It has to be a good one. And that's where the SMART framework is so helpful. Every goal needs to be specific, measurable, attainable, realistic, and time-oriented. This little acronym is a game changer for making sure every goal is crystal clear, actionable, and gives you a real benchmark for success. Let's talk about how this all plays out in the real world, on a busy hospital floor. Not every care plan is built from scratch every single time. Often they start from a standardized template and then get customized for the individual. So there are really two main flavors. You've got your standardized plans. Think of these as pre-made guides for common situations, like a patient who just had a hip replacement.
They're awesome for making sure there's a consistent, evidence-based minimum standard of care. But the real magic happens when that plan becomes individualized, when it's tailored to the specific needs, values, and goals of one unique person. That is what really boosts patient engagement and makes them feel seen.
And of course, technology is changing the game here big time. Modern electronic health records, or EHRs, can analyze tons of patient data and even use AI to suggest possible nursing diagnoses. But, and this is so important, technology is just a tool, not a replacement. The nurse is always the essential human in the loop, using their expert clinical judgment and their personal knowledge of the patient to check and validate every single suggestion. So, we've covered the what, the why, and the how. Let's zoom back out and just bring it all home, reinforcing the huge impact that a really well-crafted care plan has on a person's entire health journey. So let's be crystal clear. A nursing care plan is so much more than a checklist or some administrative busywork. It is the visible evidence of the nursing process in action. It's the place where thoughtful, critical thinking turns compassion into effective, evidence-based, and truly holistic care that sees a person, not just a patient. And that kind of leaves us with one last thing to think about. When you imagine care for yourself or for someone you love, what does quality care really mean? What are the non-negotiables? It's a pretty deep question, and it's one that lies right at the very heart of what these plans try to achieve every single day.